Let's see what happens. People are coming on. Hi, thanks for joining us. This is Kevin Robertson at the Kansas Dental Association. Looks like we have about half or so of the 330 people that registered for today's webinar. We realize not everyone will be on, but let's give it a minute or two for people to get logged in, and then we'll get started. All right, well, it is a couple minutes after 1, so let's go ahead and get started. The plan today, we have Mike Wilgus with the Dental Supply Company. He's going to talk a little bit about PPE and the availability for offices. But before we do that, I'd like to go over some ground rules. The webinar participants will be muted today. So what we'll want you to do is find the Q&A or maybe even the chat function on your Zoom controls. Mine are along the bottom. They could be along the top. They seem to be in different places depending on how you've configured your computer, or perhaps even whether you're on an iPad or a PC. But so find those. If you do have a question that you'd like to ask during the course of the presentation, go ahead and ask those. We'll go through the presentation, and then at the end, we'll have plenty of time for Q&A. Mr. Wilgus will talk for about 20 minutes or so. There'll also be some other opening remarks from Dr. Rivas, president of the KDA. So we'll have a good 30 minutes probably for Q&A, but we do want to be respectful of Mr. Wilgus's time and try to wrap at 2 p.m. So if we can't get to all the questions, we'll try to follow up with people. Let me also say that we realize there's going to be questions out there with regard to CDC guidelines and some things like that. Go ahead and ask those questions so that we know that those concerns and questions are out there that we can put in an FAQ, but we may not be able to answer those live without doing a little research. So I want to apologize that we won't be able to get to those types of questions necessarily on this webinar, but we'll certainly do our best to follow up. So with that, I am going to introduce Alan Rivas. Alan is a general dentist in Atchison, Kansas, and is the current president of the Kansas Dental Association. So he's going to talk to us a little bit about some of the current activities of the KDA and the task force that recently was put together. So Alan, if you could, there's Alan, and let's go ahead and let Alan go. Nikki, if you could move to the next slide, that'd be great.
Yeah, I would just like to welcome everybody. The American Dental Association and the Kansas Dental Association have been working really hard on these guidelines. I'd like to start off by just thanking, we put together a COVID task force, and that group has worked really hard to review all the ADA guidelines and to help us integrate those guidelines into Kansas. We've spent a lot of time trying to, I guess, fully understand them all and look at the background of them. That task force is chaired by Dr. Doug Fain, an oral surgeon. He's also an MD in Olathe, Kansas. And then the other members of that committee are Dan Nielsen, um, John Fales, a pedodontist, Grant Harris, general dentist in Garden City, and Sarah Ming from Wichita, general dentist. So they've done a great job. I'd also take a moment just to thank all the officers who've been helping on this. Jill Jenkins in Johnson County, a pedodontist. Rob Dakin from Wichita. Dan Nielsen is also an officer, and Neely Newkirk, also our immediate past president, John Sabrassi. Kevin Robertson and the KDA staff have done a fantastic job. We've had, I don't even know how many Zoom calls or conference calls, meetings to help understand and try to help members and members of the staff, staff like hygienists, the assistants, understand these new guidelines. Keep in mind they're a living document. This news has been changing every day since this whole thing started with COVID-19. It's going to keep changing. So these guidelines are what we have today. Going forward, there's things that'll change. I think we can all see that's going to happen. So the practice of dentistry is changing, and it's going to be, some things are going to change forever. So we're here to help you guys and try to answer these questions, do the best we can to get it out. We got this letter and to the governor and the KDHE out with the guidelines, also to the Kansas Dental Board. So the guidelines that you received are the guidelines that we are going by. One of the piece of advice in the CDC guidelines says that recommendations fall back to the local jurisdiction. So if you're trying to compare and swap back and forth, which one do I go by the ADA guidelines, go by what we put out. That's what the CDC even said. Go by local jurisdiction. The dental board has, at some level, agreed with these, or at least told the governor's office these will be fine. So I'm sure there'll be changes down the road. So moving forward with that, we went to the governor. It looks like, it appears as though she's going to be having a press conference Thursday afternoon, and we'll be having the counties starting next week begin to be the local authority on opening up. So at this point, I would just say tuned in to what your county commissioners are doing, what your local health officials are doing, and that should give you some guidance on what's going to happen there. So having said that, I'd like to also ask that today we focus on Michael Wilgus' presentation on PPEs. He has a ton of information, and I think at the end, if we can focus the Q&As primarily on his presentation, that there's things that fall outside of that that are more complicated, still send them in like Kevin said, and we'll address them. So having said all that, we'll move forward to Michael Wilgus. So he's with TDSC. It's a supply company, the dentist supply company. It's in 37 states. It works with dental associations in helping save members money. They've done a fantastic job. There are hundreds of offices. Michael's background is in pharmaceutical and medical. He's been in dentistry a little over 10 years. And his whole focus is finding the resources and the manpower to research these materials, get the best deals for the dentists that he can, and make it easier for them to get the most cost-effective yet quality products in their office. So I will like to turn this over to Michael Wilgus to do his presentation on PPEs. We're looking forward to it. Thank you.
All right, thank you, Dr. Rivas. If we could jump forward there, and let's not spend a lot of time on that picture because it makes me aware of how bad I need a haircut. So let's dive in. And I would like to start by showing you a map of the United States. So it's important to start here because I want you to be able to see the collective that we've all formed together within organized dentistry on behalf of members of organized dentistry. As Dr. Rivas said, TDSC is available to members in all 50 states, but we have direct affiliations with 37 state associations across the country. And the reason that's important is it gives us direct access to have contracts with the manufacturers of dental supply products, including those that manufacture PPE. It also gives us the ability to get real-time information from those manufacturers. And in a time like this, that is incredibly important because we see a lot of different activity involving PPE products out there on the gray and black markets. So I just wanted to give you this snapshot of this collective that KDA members are a part of. It's a great group. It gives us strength in numbers. And so, you know, with that, we've got a lot of commitments that we've put in place to members of organized dentistry. Let's go ahead and jump to the next slide. So when we built these relationships across the country, we talked a lot about why TDSC. And I think the more important question today is why TDSC in a time like this? You know, we started talking about the fact that we were formed by member dentists, for member dentists. We wanted to be a tangible member benefit within the tripartite. We talked about being able to save money and empower members to practice dentistry on their terms. But TDSC, essentially, we are a dental supply company that operates through a website. So one of the commitments that we had to make was to make sure that we didn't have any gray market goods on the website. Today, we've had to expand that commitment to no gray or black market goods on the website. And I think, you know, you're all probably getting solicitations out there about, you know, somebody's got a connection to a manufacturer or a factory in another country, could be China. Somebody else has got access to 1 million 3M masks. And a lot of these folks are well-intended, but trust me, if these things existed, the companies that have direct contracts with these manufacturers would have them in stock. So I'm going to show you some information today a little bit later on things that are coming across our desks as we're trying to vet out these leads for you. And then things to be aware of if you see some of these offers out there on your own. So let's take a look at the next slide, and I want to talk about what TDSC is doing currently. Due to the Defense Production Act, a lot of the manufacturers of PPE are under direct order from the U.S. government to fulfill government orders first. So 3M is a company that everybody knows. 3M is a company we have direct contracts with. They have informed us in writing several times as we get updates for them that they are still fulfilling those government orders, and they cannot give us an ETA on products that we put orders in on back in late February and early March. And to be honest, we don't know, you know, how much of a stockpile our governments are trying to put together based on what we've learned going through this situation. So we don't know how much they want to have on hand moving forward. So companies like 3M and other large PPE manufacturers are not taking orders any longer from the dental supply companies that you all know very well. Some still are taking orders. So companies who are producing things like face shields and sanitizers and disinfectants, we're placing maximum orders with those companies at maximum frequency intervals that they will allow. Unfortunately, the inventory that we're receiving from them is just a fraction of what we're actually ordering. They're under a lot of pressure too, based on global demand, and the supply chain and raw materials just wasn't set up to meet that demand in such a quick fashion. But we still get those products. I know that several other companies get those products. When we get them, the first thing we do is we fill the back orders that we have on hand. Then we release the rest of the products onto the website. And to be perfectly honest, I would say keep checking the site, keep checking with the suppliers. Typically, as soon as those products go up, they sell out within a matter of hours. And because of that, we've been very diligent at going after new sources of PPE. And the FDA and the CDC have a long list of approved manufacturers to provide items in different categories. And you can see some of the items that we're going after to try to find new supply sources. This is not an exhaustive list, but this gives you an idea of where we're pointing our focus right now. And we've got a team of about 7 people that are investigating these opportunities. But typically, if you don't have a contract in place with one of these companies, you have to get in line, and they're serving existing companies first. So we're getting in line with a lot of these folks, not only for current demand and current need, but we want to have more redundancy built into our supply chain if we run into a situation like this in the near future, like the fall or somewhere down the line. We're also getting leads from a lot of folks across the country. And if we can go to the next slide, this slide gets out of date in the matter of one day. But we're getting leads from member dentists across the country. We're getting leads from volunteer leaders. We're getting leads from family and friends. We're getting leads from leaders in the associations. So far, we've vetted probably closer to 150 of these leads to date. I've already gotten 30 today in my inbox, so I would say we're probably getting somewhere between 20 and 50 a day. And we had to come up with a process to figure out how to vet these leads out. So on the right, you can see a 10-point checklist that we came up with. It might not be all-inclusive. It might not even be the best. But this is our first cut in trying to weed out some of the noise and some of the illegitimate sources of these products. So we want to see some simple things, just like the manufacturer's name as it appears on the CDC website on all the paperwork that they submit. We want to see the manufacturer numbers for the products, FDA registration letters, and let me be clear on this. Any company can register with the FDA if they're willing to fill out the paperwork and pay the fee to have their products looked at. So just because they're registered doesn't mean that they're approved or certified. It just means that they started the process. We want to see those documents because we want to make sure that the names and the numbers match throughout the entire registration and approval process. We want to see FDA product codes. We want to see clearance letters. There are some categories like masks right now where there's some emergency use approval letters in play, or the FDA is taking the CE certification in lieu of those things. So we want to see that. We want to get samples of the products. A lot of these offers out there want us to buy huge minimum quantities, sight unseen. They'll show us a picture. We'll definitely want to look at the picture, but we want to get our hands on that product to make sure it is what they say it is, and that all of the markings or characteristics are what they need to be to make sure that they provide the safety that you need to protect yourself, your staffs, and your patients. We want to see pricing. Pricing right now changes daily, if not hourly in some cases. And there's not a lot that we're going to be able to do to change that over the course of the next several months. But what we want to watch out for are the folks that, when we ask for pricing, are asking us the question, how much are we willing to pay? What have we paid in the past? Or just offering to go out and negotiate pricing on our behalf, which typically indicates now we're dealing with the broker. So we've got to vet out the broker and the source. And so far, we haven't had that scenario that's panned out well. We want to know about shipping information. Sometimes when we see a price, we don't know if that includes actually getting the product to the United States, or is that just once the product is manufactured in the facility. So those are things to watch out for. Huge minimum order quantities. I'm seeing this more and more, although the quantities are starting to vary quite a bit. At the very beginning, we were seeing minimum order quantities of 1 million up to 5 million. I've seen up to 20 million in some cases. Now we're seeing them broken down to the 100,000 range, sometimes 10,000 range, because a lot of these sources are finding out that those quantities are easier to move. And I am seeing groups of doctors band together trying to take advantage of some of these offers because they can't afford it on their own. So they're combining forces and finances. I am seeing other associations who have been approved to make bulk purchases looking at some of these offers, and we're happy to try to help vet those out as well as when they pop up. And payment information is another one. Typically, in a normal supply chain environment, you have a contract with the manufacturer, and you've put in a purchase order, you get the product, and you've got a net 30 opportunity to then pay that purchase order. Most of the offers, if not all of them out there right now, require us to sometimes have all of the money up front with a letter of intent. They want the money in an escrow account where 50 to 80% of those funds will be released to the broker or the entity once the order is actually placed. And then they want the rest of it once the order has been manufactured and leaves the factory. So keep in mind, they want all of the money before we can even get our hands on it in the United States, which is typically a red flag. Let's go to the next slide. So how do you tell if a mask is real or fake? And this is a resource that's put together on the CDC website, and essentially shows you what to look for in an authentic N95 mask. This does not apply to KN95s, only N95s. So if we start at the top, the first thing we want to see is an approval number, and that number always starts with the letters TC. We want to see, going to the left, we want to see the brand name and or the registered trademark or some other easily understood abbreviation that we can identify. We want to see NIOSH either in block letters or we want to see the NIOSH logo. After that, we want to see the filtration class, which for our purposes is N, and then we want to see the number 95 or some other number that's higher than that. The lot number is nice. We don't necessarily need to see that. It is recommended, but it's not required. And we need to see the model number. Keep in mind, the information on the mask doesn't need to live in the locations you see in this illustration. This is just to kind of show you what needs to be present. But again, not necessarily in this location. The other thing I want you to notice about this mask is it is not an ear loop mask. This mask has head straps. So that is another key way to tell if you're looking at a counterfeit mask or one that might be legitimate. We see a lot of N95s out there on the gray and black market right now that are ear loops. So as soon as I see that picture, I know it's counterfeit. If we go to the next slide, here's some other tips coming from the CDC on how to identify counterfeit masks. So no markings at all on the filtering face piece or the respirator, no TC number, no NIOSH markings. NIOSH is misspelled. I will tell you, I'm seeing masks that have other things misspelled on them as well, or misspellings in the associated paperwork. So those would all be red flags. Any sort of presence of decorative fabrics or design or add-ons would be a red flag. Any claims for the approval for children. And then you see at the end there, watch out for ear loops. That is a clear indicator that that is a counterfeit mask. The CDC does have a counterfeit link on their website. I've got that link available for you at the end of this presentation. The nice thing about that website is if we go to the next slide, they're actually showing you examples of counterfeits that are out there in the market. We've seen several of these masks in the leads that we've been vetting out. And this website is dynamic. They're adding to it all the time. But again, it's not an all-inclusive or exhaustive list. We're seeing variations of this stuff all over the place. But if you take a look at the one on the top left, this is a counterfeit mask. It's counterfeiting a company called Dasheng. And Dasheng is a large manufacturer in China. They would be the equivalent of 3M there. They're one of the most counterfeited masks in the N95 space coming out of China. And right away, you can see it's got ear loops. So that's a clear indicator that that mask is fake. If you look at the other three masks, they're missing some of that key information that you saw in that diagram, which indicates that these are fake. And then if you look at the item on the right, this is actually packaging. And I've circled the FDA logo there because the FDA does not authorize their logo to be used on any packaging or any products. So as soon as we see that, we know right away that it's a counterfeit. If we go to the next slide, I want to show you some of the documents that we've received when trying to vet some of these leads. And it's getting more and more complex. These documents, the fake ones, are getting harder and harder to tell if they're legitimate. But this is an example of some of the things that we've seen. So the very first example you see here, the manufacturer name has been blurred out. We didn't do that for the presentation. That's how it was sent to us. So we had no way to vet out the manufacturing facility that these products were supposedly coming from. So that was a red flag. In the second example, there's a watermark on this document that says for reference only, but the word reference is misspelled, which was an indicator to us that this might not be legitimate. The third document, on the signature line, there's a name there that was signed. It looks like it says Tony or Terry, but then the name below the line, typed out in all lowercase letters, says Jimmy Engineer. Interestingly enough, about an hour before this call, I was looking at another certification document from a state association. I saw that same signature, but instead of a name below the line, it said Chief Engineer, where the word chief was in capitals and engineer was in lowercase letters. So when we see that, it definitely raises some questions in our mind to whether or not that's legitimate. And then the third item that you see over there is a document that might be legitimate. We just have no way of telling because it was in Chinese, and all of the documents that we received from this lead were in Chinese. So need to do some further vetting on that. We don't want to take it at face value. Let's jump ahead to the next slide. And here's some other things to be aware of. The first one I want to point out is any claims out there to have access to large quantity of 3M masks. 3M masks are one of the most counterfeited masks out there right now because they are the gold standard. As I mentioned before, TDSC has direct contracts with 3M, as do all of the other major dental suppliers out there. So if we are unable to get those masks from them and 3M is telling us they cannot fulfill our orders due to the Defense Protection Act, know that these claims are most likely false. 3M has assured us that nobody has appreciable quantities of their N95 masks out there anywhere in the world. So be careful with that. Any claims that N95 masks are one size fits all, not necessarily a red flag, but something you should question because some masks are and some are not. So it's important to take a look at the manufacturer, the model, and maybe try to vet that out on the manufacturer's website if in fact that is the case. If you can't get samples of the product, be careful with that. We're not in a position as a company that was founded with an organized dentistry where we're going to take a flyer on something that we can't get our hands on. We want to make sure that it is what it is and it's safe for you and your patients and your team. You see the FDA logo on the packaging or mask. We talked about that. Talked about large minimum order quantities. Anybody who can't provide us pricing, anybody who wants a letter of intent. These are typically folks that are trying to aggregate orders together and then go out and try to secure some deal through various channels, most of which are probably not legitimate. And then anybody that wants your money upfront in an escrow account with a large percentage down at the time you place an order. Just be aware of any of those scenarios as you're typically dealing with a broker or a series of brokers that are all getting a cut in that process. Let's jump ahead to the next slide and answer the question, who should you trust? And that's a fair question right now. This is me being very fair and balanced. This presentation is not meant to be any sort of plug for TDSC. So if you've been working with a well-known reputable supply company and you've had a relationship with them for a while, you should probably trust them. Trust me, Shine, Patterson, Benco, any of us would love nothing more than to sell you the PPE that you need, but it is simply not available in the traditional channels. So that in itself is a statement. Beware of things like marketplaces, and these are websites where various companies can go on and sell products. You've heard of websites like eBay or Amazon. There's a lot of them out there. Some of the folks working through those websites are legitimate and some are not. The marketplaces typically don't vet out who's selling products on their site or vet out the products themselves. Ask a lot of questions with regards to suppliers you've not worked with in the past. Many of them are legitimate, but you want to see some of the documentation for products or information that I listed early in the presentation, and it should be easily accessible for them to provide that for you if you ask for it. Unfortunately, a lot of the dental supply companies, and this would typically be true of some of the smaller ones and mid-level ones, even if they've been around a while, some of them are having trouble surviving right now. So I have seen situations where some of these companies are maybe taking on a little bit more risk than they typically would to try to get products available to sell to dentists so they can help keep their companies in business. Be careful with that. If they're selling something they haven't sold before, or if you go to their website and it says something like image coming soon, or call for pricing, things like that, I think you want to take the time to ask more questions and figure out if this is a product that's new to that company and where it's coming from. And then I talked a little bit about brokers, and these are the middle folks that are typically reaching out to us out there right now with all these great deals and availability of products. Some of them I'm sure are legitimate. This isn't something that we've had to deal with really in the dental supply space before, so we're all kind of new to it. So ask a lot of questions, take the time to go through the paperwork, I did see an instance this morning where another association was trying to make a large purchase on masks. They got a lot of paperwork to go along with this offer, but when we really dove into it, what we saw was 3 different manufacturer names throughout that paperwork. One of them was listed on the CDC and FDA site as approved. The other 2 were not. So it just led to more questions than answers. And then we had to do some vetting on the broker, which was a company in Europe, and we're not exactly sure the best way to go about that, especially since they're not in the US. Let's jump ahead to the next slide. From a lot of these PPE manufacturers, they're telling us what to expect when supply does become available. And they're all telling us pretty much the same thing. Don't expect things to become available overnight. Expect us to come back incrementally and more like a dimmer switch than a light switch. Expect the well-known suppliers to get these products first because we have contracts with those suppliers. We all have orders in place. Some of them are months old, and they want nothing more than to fulfill those back orders to get the products out to you so you can serve your patients. And expect higher prices for at least the next several months until things stabilize. And expect prices to change often. A lot of the raw materials for these products right now are in short demand. In those markets, the prices are changing daily, if not hourly. That's going to get passed on to the suppliers, and that's going to get passed on to the consumers in some way, shape, or form. Our commitment is to keep the price as low as we possibly can. We're not in this business to make a profit. We're in this to be a member benefit, which means trying to help you save as much as you can. But we know that there's going to be plenty of scenarios where you buy a product this week for a certain price. You might go back to buy it next week, and that price could be higher or lower. We're trying to figure out a way to provide as much transparency into what we're acquiring these products for so that you can see that there's no price gouging or profiteering going on. And with that, let's jump to the last slide. I think it's the last slide. Oh, no, let's talk about face shields real quick. Face shields is an interesting area of PPE. Most of the suppliers have some face shields in stock. These come and go pretty fast as well. But there's a lot of local companies, a lot of companies in the US that have been able to repurpose their facilities to make face shields. Some of them are using 3D printing. Some of them were in plastics already. And the nice thing about face shields is these are what we would call a class 1 device. So they don't necessarily need FDA clearance to be put into use. A lot of these are over-the-counter devices. So if you've got an opportunity and your locals or your regular supplier doesn't have a face shield that you like or plays nice with loops, and that's going to be a big challenge for a lot of the models that you see out there, or if you wear glasses, you need something that sits off the forehead quite a ways as well. But if you've got a source that you trust, the product fits you well, these are things that you might be able to pick up readily outside of the normal distribution supply chain and dentistry. So again, ask a lot of questions, ask for samples. I'm getting samples sent to my house every single day with face shields, and I'm trying them on with a variety of masks and my glasses and trying to figure out what plays nice and what might work well in a dental office. I would encourage you to do the same thing. So we can jump to the next slide, which talks about resources. So these are some of the websites that we're using in our 10-point checklist to vet out a lot of these leads. The first one is a list of CDC-approved manufacturers for N95s. There are about 280 to 300 companies out there that manufacture N95s that are approved by the CDC. Most of these companies, if you look at the list, you're going to see a lot of automotive companies or construction type companies. These masks exist in other channels predominantly, and they're pretty new. There hasn't been a great need in the dental channel, so you won't see a lot of dental companies there. You've got the counterfeit site. The third one is a list of companies that have been approved for emergency use, and these are non-NIOSH or non-N95 masks. So these are going to be KN95s or some other version of PPE. And if you go to this list and you're looking at one of these offers that's got a KN95 available, this is the first place that you can go to verify if it's coming from a manufacturer that's been approved by the FDA. To my knowledge, the masks that have been approved for emergency use by the FDA have been tested in terms of filtration, so that 95% filtration factor. But these masks do not have the same seal as an N95, and these masks do exist in ear loop. In fact, most of them are probably ear loops. This isn't the only step that you should take in vetting out a KN95. This is just a starting point. If you don't see the company's name on there, it could be a legitimate KN95. It's just not been approved for emergency use by the FDA. Then you still want to see the paperwork from the facilities that are manufacturing these and make sure that it all lines up. And then the FDA authorized N95 and KN95. Actually, I think I might have just gotten that backwards. But both of these are related, so they're both great resources that you can use to bounce off of each other to make sure that the source of the mask you're looking at is legitimate. With that, I'm going to stop talking through slides, and we'll open it up for questions. So I appreciate your time and your patience, and I do appreciate the opportunity to be here and speaking with you in person. And hopefully some of this information is clearing up a lot of the confusion and frustration that's out there. So with that, let's go ahead and open it up to questions.
Fantastic. This is Kevin at the Kansas Dental Association office. So again, if anyone has a question, you can either find your Q&A on your Zoom or post a question in chat. Got a couple questions, Michael, that have to do with K95, N95 mask and K95 mask for that matter. So first, let's start with the differences with a KN95 mask. A lot of your conversation was about N95s. How are KN95s different, and as far as fit tests and how to get a hold of those?
Yeah, a couple of the main differences come in how the masks are constructed. So KN95s will typically have, if you're dealing with one that's foldable, it should be a 4-ply mask in most situations, where a lot of KN95s are 3-ply masks. KN95s do not have the same seal that fits around the face. So there is opportunity for gapping on the side, which could allow aerosols to enter into the mask and allow you to breathe in those aerosols. The filtration should be the same. So the KN95, from a filtration standpoint, is the Chinese version of an N95. So in that respect, they should be the same. If you look at the CDC guidelines on what they want offices to wear, recommended PPE versus acceptable, you'll see the N95 is recommended and the KN95 is acceptable. You just want to make sure that it's coming from a vetted source.
Well, while we're talking about those masks, Michael, there was a couple questions about the fit tests for N95s. I know that the initial test is still required, and if you already have been fitted, the annual test right now is, they're saying that you don't need to have the annual test if you've already had the initial. Do you have any information about the fit test or how that works, where you would get that done? Or
Yeah, good question. So I know that each manufacturer typically has information on their site about fit tests that might be specific to that mask. I use 3M as an example. They've got that information available. They actually have videos and they have fit test kits. To my knowledge, I think any of the fit test kits that are available out there are probably acceptable. They probably aren't brand specific, but I don't know that for sure. So I would say check with the manufacturer. But that would be another difference between the N95 and the KN95, is that you do need to have the fit test for the N95. And they come in different shapes and sizes. So just know that, if one brand doesn't fit your face well, that doesn't mean that another brand or another style won't.
Okay, very good. I'm actually going to I know that Dr. Fain, who chaired our task force, as well as Alan are on the line. I'm going to ask a couple questions and unmute them. So I've unmuted you, Alan, or you may need to unmute yourself too to answer a couple of these. There is a question about the KDA's guidance and with regard to external suction. Dr. Fain, are you able to answer that?
Yes, maybe a little more clarification on what they mean external suction. We had discussed high volume evacuation.
Yeah, that's the question, was just what is KDA guidance in regards to external suction? I guess I would interpret that as high volume evacuation as well. So that was included in those requirements.
Yes, and they had talked about that with possible almost taking care of all the overspray that might come from aerosolization, and particularly with different products that use the high volume evacuation intraorally and extraorally.
Yeah, and with the guidance from the CDC and ADA to do whatever's, take precautions to lower aerosolization, I believe was where that was with that particular guidance. Alan,
yes,
anything you wanted to add, or is that?
No, I think that's good. Yeah, I think products like the Isolite, things like that are huge. The other thing that we did have some discussions about, which it wasn't really clear, but there are some external suction systems like, we call it the elephant trunk because we couldn't think of the name of it, but there are some external suctions that set outside the mouth. And there was really no clear comments or guidance on that. So I think just use HVE, especially with the ultrasonics and high speeds, would be huge.
There's also a couple questions while Alan and Doug, while you're still kind of unmuted. There's a question about, will the KDA come up with their own guidance or guidelines apart from the ADA? So I don't know if you'd like to answer that.
I don't see that happening. I think the ADA toolkit was really very well done, and I don't want to ever say never say never, but I think having something that is well thought out, as the ADA document was, and with the basics, and it's as good a science as we have right now. I think speaking with one voice and one solution is probably the best way to go. So I can't see us doing that, but you know, this is the ground shifting all the time, and in medicine things change from a day-to-day basis, so we have to be willing to make changes as we see they might need to be.
Yeah,
That was my thought.
we do have some questions also with regard both to face shields and ear loop masks. So one is, if we only have level 1, 2, or 3 ear loop masks, and it says, quote, suggestions, I believe the KDA guidelines and as well as CDC does say that a surgical mask with a face shield is an appropriate alternative. Dr. Fain or Alan, Dr. Rivas, would you like to comment on that? Or
I think the face shield with a level 2 or level 3 mask seems to be appropriate. The level 1 with the 95% versus the 98% on the level 2 and 3, I don't think you should use that. The level 1s I think are specifically for triage or for giving to your patients once they're in the office. But as far as a treatment consideration, level 2 or 3 plus the face shield.
it's sort of a similar question. My understanding is that face shields are only required in the absence of eye protection. Most loops wrap around the sides. I think, again, the recommendation was really any face shield with a surgical mask or eye protection alone with a N95. Is that right, Dr. Fain?
With an N95, I think with the eye protection, which is, I think people need to be aware that eye protection isn't just your normal glasses. They need to be have side protection, and so you can't consider them just your glasses. They don't have to be goggles, but they do have to be specific eye protection. That plus the N95, I think, is adequate. I think the face shield does give you a little bit better protection with the level 2 and 3 mask. That's my understanding.
There's
I would agree.
questions. I'm sorry, Alan. There's a
I'm
question.
sorry, I agree. Dr. Fain's right on.
There is a question about whether or not we'll make copies of these slides and make those available to you. Mike, is that all right if we do that? Do you have any problem with that? All right, we'll make sure that happens. We'll get those out to the attendees. Level 3 mask. Okay, here's a question. Again, I think maybe we've answered it. When we open back up, are we allowed to wear our level 3 masks, or do we have to wear the N95? I think Dr. Fain just talked about that with regard to the combination of protections. Do you want to, anything else you'd like to follow up with that, Dr. Fain?
It N95s are certainly the best things to have, but the ability to have those is we're not there yet. So I think if you use a level 3 plus a face shield, that certainly to me is a little more protection than the mask alone.
There is a question regarding, or really kind of several questions about fit testing, and then some follow-up questions saying, or comments saying that those have been very difficult to get a hold of. There was a comment by another participant saying that the OSAP webinar with Eve Cuny and Kathy Eklund on the ADA website was very good on the fit test requirements and protocols. So I would urge people that have questions and more specifics about fit testing to check out that webinar, the OSAP webinar with Eve Cuny and Kathy Eklund that the ADA did. I'm going through these, so hang in there.
I will make one comment about the level 2 and level 3 masks. As far as particle size, they're the same. And as far as percentage of clearance of those particles, they're both 98%. Seems like the only difference there is in moisture penetration, or so I think they both give a good level of protection.
Well, here is a question. I think Alan and I, maybe we talked about this last week. Certainly it's a question that's come up before that I've gotten. Have you seen the Fix the Mask fit bands for surgical mask tightening of facial seal, for the facial seal? Any comments on those, on that concept? And that's using those 3 rubber bands and or the special product that they provide. Alan, or did you want to?
Yeah, I have not used those. One of the dentists in our practice, I think, has some for us to try. I would ask Michael, what do you know about those?
Yeah, I know very little about them, to be honest with you. I've just started to see them recently, but I don't know anybody that's actually had a chance to try them out.
I know one. Go ahead.
Oh, someone had made the comment in one of our committee meetings, is that when you put those on, it does kind of compress the mask against your nose. And if you have any moisture at the tip of your nose, like mucus or whatever, it can soak through the mask and make it less efficient. And that was one of the concerns, particularly using it on an N95. I think the N95 is designed to be away from the nose. That's the only comment I've heard. But
that's the comment that I recall too, concerns about just moisture getting on the mask because it would push it so close to your mouth and nose. Yeah. Would be the main concern on those Fix the Mask bands. There was a question about, okay, is it acceptable to wear a level 1 or 2 mask over an N95 in order then to reuse that N95? If so, how long is it acceptable to do this? I don't know that I've seen anything on that. Dr. Fain or Dr. Rivas or Michael. I don't know if you've seen anything on that.
I don't know anything specifically about that, but that's what I have my staff do. You know, our N95s are limited, so we do reuse those. We kind of reuse an extended use, so we put them on at the start of the day and then take them off at the end of the day. Day meaning just the morning, and but I do have them cover them with a level 1 just to keep the exterior surface clean, so we can discard that but keep the mask.
Yeah, I know there's so that's led to something that I know that Dr. Rivas and I were talking about prior to this webinar starting. Has to do with the decontamination of masks, of N95 masks, and how that might work. I know at this point we don't know if there's sites or will be sites. Alan, do you have any comments or thoughts about that, or Dr. Fain?
I don't. You know, what we're doing now with reusing these masks is not the way they're designed, but you know, in this environment we are where we can't get them, and we're trying to conserve resources, and reusing them is certainly the way we can do that. And so, you know, it's just, I don't know if there's anything specifically written about that, or if there ever is going to be, just because we're in a state where we have to kind of make things up as we go along, you know, just to like I say, save the resources, reuse the masks, just so that we have them.
I know there is a comment about using a UVC light box for decontamination. I'm afraid I don't know the answer to that, how that works. Perhaps that's something that we can try to follow up on and then get that out to our members if there's a way in office to decontaminate those masks. I think that'd be something our members would be very interested in knowing about.
Yeah, it's something I'll keep an eye out for, and maybe ask some colleagues around the country to see what they're doing. A lot of them are just kind of covering them, like I say, with that with a level 1 or level 2 mask, and then just keeping and then saving the mask, but just putting it in a paper bag and not doing anything specific, just giving it time to dry out. And the desiccation on the face of the mask, if there's any contamination, you would think that it could deactivate the virus given enough time.
Dr. Fain, I'm not sure that it matters to our attendees or not, but since you're the guy on, do you want me to, can you unmute or turn your camera on, or is that okay right now?
I'm pushing on the start video thing on my thing, and it's not letting me do anything.
Now it should work. Go ahead.
Okay, there we go.
All right, good deal. We have a question about air purification system in operatories. I know that's another thing the task force at least had some discussion about, you know, what was required,
Yeah.
and not required.
It's there's no specific recommendation from the ADA. It doesn't even mention that. You know, if you look at the negative pressure room, it's define that as a turnover the room air at 12 times per hour. You know, I don't know if there's anything, you know, given some of the mobile or, you know, little air purification things that you can get for the room for allergies that decrease the particulates in the air and all that. And I don't know if there's anything that you can say about that.
Okay, very good.
Certainly nothing.
I'm just going to comment. There was someone made a comment about steam sterilization of an N95 in a microwave, and the fact that there is an entire CDC article on that already, how to do that in office. So I guess I would point people to that, not knowing exactly where that is, but to look for that.
Yeah, I'd say be careful with that. Hopefully there's some information in there about the metal strips across the nose. You don't want metal in the microwave, and a lot of times the straps are stapled to the mask. So it might not be the right solution for all N95s.
And I think I was talking to a colleague in California. One of the concerns about trying to decontaminate these things is that it may change the structure of the mask itself, and so it may not provide the filter that it once did. You know, that's just. But again, I've not seen anything other than just comments from people.
Okay, I'm trying to get through these. I know it's getting, we got about 10 minutes to go, so trying to get to as many as I can. There is a question about and I can answer this, or maybe you, Doug. Yesterday, the KDA did send that informed consent document out to our members just to have them look at it as a possibility. Dr. Fain, it was the one that was provided by the task force. There is a question about, is it necessary? It was very strong wording, seems it will scare away most patients. And let me say, you know, that was provided as something for our dentists to take a look at and consider. There was at least one professional liability insurance carrier that was suggesting that to their insureds. So we wanted to make that available to people. We've gotten some other calls and questions about that over the last, 6 weeks. So we provided that as a resource. It's really up to you and your professional liability carrier. Certainly not a recommendation or requirement that the KDA is.
Yeah, it's I think what I took away after reading that, and I do have my patients sign that, is that it just kind of lets them know that we take it seriously when they come into our office for emergency treatment, that they understand that, we're taking their word for it, that this is an emergency for them. And so at least they'll think twice about it, or they may not be able to come back and say, well, I went into the office, I didn't need to be there, and they did all this work, and now I'm sick. So it just is a little level of protection, but it's not to remove all liability. In my mind, it was just more or less to let the patient know that we take this very seriously, and that we have their well-being in mind, and just want to make sure that they take it as seriously as we do.
For those of you interested in that decontamination process, the person who posted that in chat has now posted the CDC link, so you can see that looking in the chat box, and we've written it down as well.
Good.
Does polishing during hygiene appointments cause aerosol or just spatter? I don't know that I know.
I don't know.
I haven't seen anything official on ADA. I know that the polishing has come up with one of the things as far as to reduce aerosol. That seems to be one of the items, along with sonic scalers and ultrasonic scalers.
Well, it seemed like I read something on I think it's on the CDC website about, they just kind of lump all rotary instrumentation together. Whether it's a drill or a prophy cup or something, they don't seem to make a distinction between high speed, nitrogen driven, electric, any of that. They just talk about rotary stuff.
Mike, somebody has asked for your contact information. So again, if I send this out to the participants, are you good with contact information going with it?
Ooh.
But your personal.
You want my home address on my cell phone? Email would be fine. Yeah, if you want to share out my email, I'm happy to field questions that way. And I saw something pop up on the chat, and this was something that I heard in another task force that I'm part of in another state regarding the ADA toolkit, I think. I had heard in that task force that the requirement for fit test was not required at this point in time, and I did see that pop up in the chat. So you might want to check that toolkit just to validate, but that might be good news for everybody for the short term.
Very good. Somebody asked about training for an N95. I think that fit test would go through all that. We've covered that. Somebody's asking if it is, okay, that was, never mind. If we don't have an N95 mask, should we open? Or if we do, what is our liability to staff and patients?
Well, I think with a level 2 or 3 with a face shield and eye protection, I think you'd be. I think according to the ADA guidelines, you'd be all right.
With aerosol reducing, if you limited aerosol producing procedures, perhaps, or
yeah, a lot of that they just kind of defer to the doctor to kind of use your own judgment. But it seemed like, yeah, using as much of the high volume evacuation plus the level 2 or 3 mask and the face shield, you just kind of do what you can do, just because the resources are limited.
There is a question about air purifiers in general. You kind of hit on that a little bit, I think, Doug.
Yes.
There's
nothing required, but I mean, I did get some from my operatories just to kind of turn the air over, I think probably 4 or 5 times an hour, but I don't know, you don't know what the effectiveness of that is. They certainly are not required.
Here's a question. I'll put you on the spot too. Is a level 1 mask and a standard lab coat appropriate for exams?
Well, any exam, you have the possibility of a gag, and the level 1 mask is certainly not adequate in that respect. If something untoward happens, the patient coughs on you, or sneezes on you, or gags, I don't think the level 1's an appropriate level for that.
There's been a few questions back and forth here, and again, I apologize, everyone. There's a lot of questions between chat and the Q&A, so I've been trying to go back and forth. But questions that have to do in general with gowns, disposable gowns, cloth gowns. How often do you have to replace those? Long sleeves versus short sleeves and things like that. Dr. Fain, is that question you feel comfortable answering?
Again, it's I don't think there's anything specific written on that, but I do think long sleeves are indicated. The gowns, disposable gowns, certainly one use only. Reusable gowns, they don't mention changing but after every patient. They from what I had seen, it seems like it was kind of wear it during the day, and then if it's soiled, you'd have to wash it, but otherwise it just launder it at the end of the day.
Yeah, I was looking at the recommendations. The CDC recommendations do say to change after every patient, but then it does say that if gowns are limited, that you should prioritize the use of those gowns for of course, for the higher aerosol patients and patients with spatter. Fix a mask. Looks like a lot of the things I'm starting to, there's some comments about the fix a mask comment. The level 3 has the same filtration as an N95 except for the fit. So really that fix a mask is really meant more for level 3. Somebody commented. Somebody commented the CDC has guidance specifically on reusing PPE. I don't know what that guidance is right now without looking that up. decontaminate. A lot of comments back and forth, I guess, with the folks. So as I go through that, oh, here, this one is for you, Michael. I know you stated PPE will come in slowly. Any time frame on the arrival? You know, when are you? Any thoughts on when the dam might break, as they say, to that?
Not in terms of the masks. We're still getting some level 1s and some level 2s in. We're not really seeing anything in the way of level 3s, and those manufacturers aren't able to give us an ETA on those or the N95s yet. Once in a while, we'll see some show up at our distribution center that we ordered, but only in a really small quantity. We are starting to see a little bit of headway in the sanitizer space. So some of the sanitizer companies have told us we'll start to get increase in supply here in the next couple of weeks, citing mid-May, others end of May or 1st of June. So we expect to have better supplies on stuff like that in the very near future. Face shields, again, we're getting them. I think there's some sources that you might be able to find locally that provide good options as well. Gloves, everybody's still pretty good on gloves. I do know some manufacturers are starting to order from the factories for December. Typically right now in April or May, you'd be ordering for July. So we're keeping a close eye on that, but so far gloves are fine. Gowns is another area that is impacted pretty heavily. There's not very many manufacturers that make gowns. So we expect those to come back very slowly, but none of these manufacturers for gowns or masks are giving us any dates yet.
Can you, let me just comment. I know that from my discussions with the ADA and their lobbying team specifically have been working with the federal government, specifically FEMA, trying to free up masks for dental use. So right now, as already mentioned by Mr. Wilgus, those government contracts supply FEMA, then they provide the rest of the country. And right now, dentistry is not at the highest priority with regard to those masks. So the ADA is working very hard with FEMA to at least free up a portion of masks that can go into for dental use. So I believe they're getting very close, or maybe even may have an announcement very soon about that. I'm not sure what the exact timeline is for that. So, but the last comments that I heard earlier this week were very promising. There is a comment or an answer that the CDC website has information on extended use and reuse of masks, 72 hours minimum before the virus should have died on the surface. CDC masks for each day of the week recommended would leave 7 days between reuse, but the mask would be handled as if contaminated. So there's some more comments about how to take care of sterilization of masks. Here's a question, and I don't know that I know the answer, is a K95 mask, when we talk about sterilizing an N95 mask, is it similar to then a KN95? Would it be the same difference? Dr. Fain or Michael, do you know?
I'm not sure. I thought some of them, I thought the K was designated Korea, but I'm
They are, but I don't know if like the sterilization process, whatever that sterilization process is, would it be the same? Would it also affect those? Well,
and
we don't know.
Really sure.
That's fine. We don't know. We'll have to get an answer for that one. What is your thought? It is 10 minutes after 2, and we were trying to be done. I know Dr. Rivas had to leave for another commitment he had at 2 o'clock. I think what we'll do is we'll look through the rest of these and try to distill these and answer these questions in a document to the best of our ability and get that out to everyone. For the attendees, it looks like several people are starting to bail out anyway. So we appreciate your participation. We will make the slides available to everyone. We've recorded this as well, and we'll get Mike Wilgus's information out to everyone. So with that, is there anything Dr. Fain or Michael you'd like to say before we head out?
One thing I do like about the ADA document is that it does give the doctor a certain leeway in judgment, and so I think this forum has been great. Appreciate all the information, but I think by following that document and then asking colleagues, and I think we're ready to begin our opening.
Well, and here's a question that pertains to that I guess I missed the first time. And the question is simply, are we really going to get to open on May 4th? The expectation that we're hearing from the governor's office is that tomorrow at 2 o'clock, when the governor has her daily press conference, she will be laying out her strategy for reopening. That strategy then will alter the stay-at-home order and then provide guidance for group gatherings or changing the restrictions on group gatherings. But she will also then, kind of to where we were prior to this, she will defer to local units of government, local health departments, whatever, for guidance. So perhaps in some counties, they may continue a stay-at-home order. They may have other more restrictive guidance than the state. So the information that we sent out with the letter to the governor and those ADA guidelines that went out to all dentists, all KDA member dentists, on Monday morning, we also then urged you to forward those documents on to your county health officer, your local health department, so that they have that information as well. So if you have not done that, we certainly would encourage you to do that, and to try to then work with your local county in order to urge them to stay open as well. So it's difficult. The KDA's trying to keep the state and federal stuff for the 105 counties to figure those out. So please get that information to your local health department, your local health officer, and to make sure that they don't do something more restrictive in your own local area. So anything else? Guys,
No, I just appreciate the time. Thanks for the opportunity to be of service.
Thank you, Michael. Thank you, Doug, for all your help today, and Alan, who's already off. And thank you all the attendees for being with us today. We appreciate it. That'll end the webinar.
Well done. Thank you.